The oral rabies vaccination program was created to combat two epizootics or epidemics in animals. There had been 2 deaths in the South Texas case, and it was spreading rapidly. By the time we intervened with the oral rabies program, it had almost reached San Antonio. It involved like 74 counties. So that program is continuing to this day. And in the case of domestic dog coyote variant, there have been no cases identified since 2005. In the West Texas fox variant, there have been no cases since 2013. It's not often that you have a public health intervention where you have definable metrics to say this was successful. And ORVP is certainly that.
Dr. Thomas J. Sidwa devoted his 26 years in the Texas Department of State Health Services to investigating emerging public health threats and protecting Texas residents and animals. While working with the animals became Sidwa's calling, his path would grow into something much bigger.
Well, my decision to be a veterinarian as my occupation that decision was made in my early teens. Showing horses, and so I had some interaction with equine veterinarians, and I worked in a small animal practice as well. Veterinary medicine was always my primary goal, and I was lucky enough to be able to pursue it. I suppose it's cliche to say, but I love animals. So that's a significant part of that decision.
After graduating from Texas A&M University, Sidwa built a career in private practice. After 20 years, he began to realize his veterinary training could serve a broader purpose.
Got a little tired of being in the building all the time. And so that led me to employment with the State Health Department. Both of the programs within the Health Department, both zoonosis control and meat safety, allowed me to actually get on the road some, go to plants and go to conferences and present and meet with local authorities, and it's just a different environment. I traveled locally, statewide, nationally, and internationally during the course of my career and met a diverse group of people, experts in many cases, so it was quite fulfilling.
His move into public health marked a turning point in his career, with his work expanding from individual patients to entire populations and communities.
I think one of the most impactful responses we had to do was to West Nile virus. It required creating procedures, creating means of communication, defining what constitutes, for reporting purposes, defining what constitutes a case, whether it's fever, West Nile neuroinvasive, and so forth. The challenge to the infrastructure, the epidemiologists and the people and the vector control people. And again, in many cases, they had to create programs that weren't already there in local jurisdictions.
While some successes could be measured in numbers, much of his work happened behind the scenes. His effort against West Nile virus, for example, protected communities in ways most people never see or fully realize.
The reason that I consider it a major event is that it caused so many resources and creation of new procedures and new metrics and new communication. And there was a lot of training, both online resources that were created, as well as in-person training and coordinating with other organizations who helped to provide that training. Our epidemiologists were slammed dealing with local epidemiologists about case definition and reporting, and did all the case reviews. And it's not something unlike the oral rabies program where you say, well, we've achieved this end point and we're going to keep monitoring. There's no end to this thing. And in fact, in 2024, Texas led the country in cases, a dubious honor, but it's here. It's going to recur year after year.
In managing these large-scale emergency responses, Sidwa's work demanded both scientific expertise and strong leadership, including the ability to respond in rapidly changing situations, such as during Hurricane Harvey.
We evacuated, I think it was 3,200 people, 990, I think it was, medical response missions. We provided 70,000 doses of vaccine for responders and patients. We established medical special needs shelters We conducted the health surveillance in both those and in the general population shelters to detect disease and address it. So there were a lot of moving parts in this and by a lot of different stakeholders and partners. It was very fulfilling to be involved in something that massive that impacted that many people.
This deep commitment to service, public health, and the veterinary profession can be measured in lives protected, systems strengthened, and communities served. Yet, in receiving this award, Sidwa recognizes that collaboration remained a constant in his career, shaping the way he led and the impact he made alongside his DSHS colleagues.
Everything I've done in public health has had a collaborative tone to it. It's not a one-man show, so without them, none of our successes would have been realized.
Now retired, Sidwa lives in Lakeway, Texas with his wife, Marcia. He spends his days hiking local parks and trails with his dogs, Toby and Penny, and volunteering on the board of directors for Lakeway's Friends of the Parks and with the Lakeway Police Department's Citizen Police Academy.
My wife, Marcia, she's been with me for the entire course. And when we're in private practice, she was directly involved in our practice. We started dating at 16, married at 22, two wonderful kids, my son Alec and my daughter Courtney, and then they blessed us with a couple of grandkids apiece, Nathan and Claire and Miriam and Madeline. So certainly hasn't always been an easy ride, especially my transition from one type of career to another. And the moves that were involved in that were a challenge, and she hung in there. So,
for Sidwa, this award represents the peak of that journey.
I was very honored and quite humbled by it, but had no expectation of it. It's in essence, it's not a retiree. It's basically the culmination of my career, and very, very happy about it.